All right, well, welcome everyone to another budget hearing of the now joint subcommittees for Health and Social Services in the House and the Subcommittee on Health and Human Services in the Senate. Today we're going to be hearing three budgets. The budget of the Maryland Institute for Emergency Medical Services Systems, colloquially known as MIMS, the Department of Housing and Community Development, and the Department of Disabilities. I believe we're going to start with MIMS. So we'll turn it over to Andrew Garrison for the Analyst report.
Thank you, Mr. Chair. Can you all see my screen? Awesome.
Yes.
As Chair Resnick mentioned, this is the budget for MIMS. These are the folks who are responsible for the state's emergency management services, as well as the communication. So we're going to be talking a lot about EMS providers. This is a $20 million budget with only a very modest increase we're showing this year. And what I want to focus on first is the role that MIMS played during the COVID-19 pandemic. That's reflected in some fiscal 2020 funding for those ambulance strike teams that you heard about. And so with MIMS as being responsible for a lot of EMS responses, did receive some reimbursable funds from CARES to help facilitate those strike teams that were going into nursing homes and providing the ambulance availability for that. Skipping towards the difference that we're going to be looking at from 21 to 22 of a $118,000 increase. Most of that's coming into personnel expenses. As you can see here, that actually nets out to $112,000 of that 118, and then the remaining comes in from some of these grant changes here. The one I want to highlight that actually represents a programmatic change is that Essence grant that is going to be allowing EMS data to be used by the Department of Health, that is, to look at early identification of infectious disease outbreaks. Lastly, because this is a budget that does focus a lot on communications and the EMS communications in the state, they are in the process of upgrading the state's communication system. What we have shaded in green was the first stages, and that's nearing the end of implementation phases. And then the purple is what's going to be next, what will be installed next as these communications upgrades continues. MIMS reports a slight delay due to COVID and being able to physically enter hospitals to do some of those upgrades. That created about a 2-month delay, but they're still anticipating this project to be done by fiscal 23. And so that last phase would then be on the Eastern Shore. Ultimately, DLS is going to be concurring with the governor's allowance. That concludes my presentation on this budget. I'd be happy to take any questions.
We can panelists. So any questions for the analyst about the budget presented? Not seeing necessarily any. My screen is not. Hang on. There we go. Not seeing any questions. In that case, let's move on to the department, and we will call up Dr. Theodore Delbridge, the Executive Director of MIMS. Dr. Delbridge, I believe you have several other people signed up. Are they just here for questions?
Yeah, they're here for background in case you stump me with a question.
Sounds good. Well, we will hand it off to you then.
Well, I'll try to be brief. First of all, we're grateful to Andrew Garrett for his comprehensive analysis of our budget, and also to Brianna Brown, who's MIMS DBM budget analyst. We're grateful to them both. I thought I would provide just some color commentary to some of the information Andrew provided about our COVID-related initiatives and things that are unrelated to COVID. So as he said, we've been fairly active. Part of our response has been to provisionally credential more than 1,400 EMS clinicians earlier in the year. These were EMTs and paramedics who were expired or had yet to complete the practical part of their experiences for their education. And we pulled them into the EMS system to augment the workforce, and are now in the process of credentialing them on a permanent basis. About 20% of them have taken advantage of that opportunity. So we continue to try to augment the workforce. We used the MEMS licensure apparatus to credential EMS clinicians, to credential more than 1,300 nursing and respiratory care students across the state. We worked with every nursing school and respiratory care program in the state of Maryland to create credentials for those students and clinical competencies that would be recognizable within the healthcare system. To date, probably half of them have been engaged in providing healthcare, and the other half are standing ready on deck. And most recently, we stood up a thing we're calling the C4, the Critical Care Coordination Center, that tries to match the critical care needs of patients in emergency departments and hospitals with available resources throughout the state, and in some cases beyond. Since standing up in the beginning of December, we've helped over 600 people. We do that with a coordinator within our communications center and an on-call critical care physician who helps us manage the clinical needs of patients. We haven't lost sight of the necessity to plan for the future, and with that, we updated the EMS plan this year. It was approved by the EMS board in August of 2020. The plan, Vision 2030 plan for the EMS system, is multi-faceted, I would say, involving multiple areas of the EMS system in Maryland. We're in the process of developing key performance indicators so we can track our progress on meeting the goals that we established for ourselves. We've been working with the Chesapeake Regional Information System for Our Patients, or CRISP, the state's designated health information exchange, in order to provide a real-time awareness for EMS clinicians of emergency department conditions throughout the state. Right now, EMS relies on subjective input by hospitals to go on various levels of alert, and we were trying to make that more objective, and we hope to have something rolled out by the end of spring. In a similar vein, we've created a dashboard we're calling the At Hospital Ambulance Dashboard that lets EMS clinicians know when ambulances are at hospitals and may have arrived recently, so they know to avoid places that are particularly overwhelmed. And finally, Andrew mentioned the communications system upgrade. We're implementing it in 6 counties, what is EMS Region 5 in the state, and equipment is being delivered in another 8 counties, and we're still on target to finish by the end of fiscal year 2023. As he said, we experienced some delays just getting into hospitals at the beginning of the pandemic and are trying to work through to sort of recover some momentum from those delays. And I'll stop, and I'm happy to try to answer any questions. Thanks for this opportunity.
Wonderful, thank you. Are there any questions for for Dr. Delbridge? Seeing none. Thank you very much. Oh, there is a question from Delegate Valentino Smith, please.
It will be very, very quick. Thank you, Dr. Delbridge. You are responsible for doing the National Capital Region Mass Casualty Incident Response and Preparedness work. If you don't have to answer now, but if you could just send forward to the committee any findings you have from that or anything that we would need to know about our mass casualty preparedness would be helpful.
Certainly will. Thank you.
Thank you, Mr. Chair.
Oh, that was very brief. Anybody else have any? Chair?
Thank you, Mr. Chairman. Mine is brief as well. Thank you, Mr. Delbridge. I was very interested in the at hospital ambulances dashboard you talked about, but I missed where you said it was in terms. I saw that you are developing a mobile version, but is this fully operational statewide now?
It's how to answer that. It's probably 2/3 operational, meaning the EMS clinicians can see it on their portable computers, on their notebook computers that they walk around with. We're in the process of developing an application that will be available to them on their cell phones. And the other piece of that is it relies on the computer-aided dispatch data download to come from the jurisdiction through the documentation system to MIMS to get usable in some format. We can see about 3/4 of the state now. And the areas that we can't see are due to currently in-flight upgrades in their computer-aided dispatch system or some other innovations that they have to make. The most recent add-on was Baltimore County. So we have a critical mass, but we're still missing some significant places, and they're actively working on those.
Thank you. Is this something, if I could follow up, Mr. Chair, is this something that's operating like across the country? Is this like, how did we, I don't want to take too much time, but I'm just curious as to how we got this initiated here.
We made it. If I can give a quick example, I use Anne Arundel Medical Center a lot. So if you are a paramedic in Anne Arundel County for the Anne Arundel County Fire Department, you know how many ambulances are currently at Anne Arundel Medical Center. You can find that out. And if you had a choice between taking a patient to Anne Arundel Medical Center or Baltimore Washington Medical Center, you might factor that into your decision making along with the patient's preferences. What you can't see is how many ambulances at Anne Arundel Medical Center are there who came from Prince George's County and Calvert County and Queen Anne's County. You have no idea. So you might think that Anne Arundel Medical Center is having a splendid, quiet day. In the meantime, they've recently gotten several emergency patients that you would have no idea about. And so that is the backdrop, that's the background, the impetus to develop that hospital in this dashboard so that an EMS clinician in the field can get a more complete picture of what's happening in the emergency department before they take a critical or not so critical patient there. We dreamt it up.
Good. Keep us posted on that. I'm very interested in that. Great work. Thank you. Thank you, Mr. Chairman.
Thank you. Are there any other questions for this witness? Seeing none, I believe that concludes the budget hearing for MIMS. We will now move on. Thank you. Thank you to Dr. Delbridge. We're going to now move on to the budget for the Department of Housing and Community Development and our analyst, Emily Haskell.
Thank you, Mr. Chairman. Let me just share my screen. Okay. My name is Emily Haskell, and I'll be presenting the analysis for the operating budget for the Department of Housing and Community Development, or DHCD. In the budget summary on page 1, you can see DHCD's budget declines by about $124 million in fiscal 2022 to a total of about $400 million, mostly due to COVID-19 funding provided in fiscal 2021. Other changes include an increase of $15 million in federal funds for rental subsidies under DHCD's Section 8 contract with HUD, which is about a 6% increase, as well as a decrease of $4.5 million in general funds. This decrease is due to shifting $1.3 million in broadband funding to the capital budget, as well as the elimination of $1 million for the qualified workforce housing tax credit and a $2 million deficiency appropriation in fiscal 2021 for the Maryland Housing Counseling Fund to backfill for lower than normal revenues from foreclosure fees. It's worth noting that this chart does not reflect a significant amount of COVID-19 relief funding provided by DHCD. The federal December relief legislation included a little over $400 million in rental assistance funding for Maryland, of which about $258 million will be administered by DHCD, with the remainder going directly to the largest local jurisdictions. In addition, the chart doesn't include $15 million for entertainment venues or $10 million for the Assisted Housing Relief Program in fiscal 2021, as the budget amendments for these funds are still being processed. I'm going to spend most of the rest of my time talking about the relief funding DHCD is providing. Exhibit 4 on page 11 shows an overview of all of these relief programs. And I'm going to keep this up on the screen, but the subsequent pages contain some of the detail I'll talk about. And then for most programs, there's also an appendix showing the awards by jurisdiction. Overall, relief provided by DHCD totals over $430 million. Most of this is federal funding, but $35 million is from the Rainy Day Fund. As you can see in the top chart, the new federal stimulus will constitute about 60% of all of the relief. I'm going to come back to this new program in a minute, and I'll talk first about all of the programs that DHCD has already implemented. About $75 million went toward 4 housing assistance programs. Those are the orange and yellow ones on the right side of the bottom chart. For the Community Development Block Grant Program, DHCD awarded funds it received through the CARES Act to local jurisdictions, primarily for rental assistance. Of the $26 million total, $16 million was eligible to be awarded to all jurisdictions, while the remainder was reserved only for jurisdictions that didn't receive a direct allocation from HUD. The direct allocations totaled $47 million in addition to what flowed through DHCD. The Emergency Solutions Grant Program funds homelessness services and prevention. DHCD awarded $14.8 million from the CARES Act for the smaller jurisdictions, while larger jurisdictions received $35.6 million directly. The CARES Act also provided nearly $14 million for the Community Services Block Grant Program, which DHCD awarded to local community action agencies. The final housing program is the Assisted Housing Relief Program, which provided rental assistance for tenants in multifamily housing projects financed by DHCD. $20 million in coronavirus relief funds was initially allocated for the program, but because those funds were originally supposed to have an expenditure deadline of the end of last year, DHCD diverted nearly $5 million of funding from this program to provide additional awards to local jurisdictions for rental assistance. The blue programs on the left represent $76 million in business and nonprofit relief provided by DHCD. The largest program is the $41 million Nonprofit Recovery Initiative, which included $8.2 million for tourism nonprofits. Initially, $10 million was also intended to be reserved for providers licensed by BHA or DDA, but eligible applicants claimed only $7.9 million, so the remainder was made available for other nonprofits. Rainy day funds were used to provide $30 million in grants to entertainment venues and independent movie theaters, and $5 million was awarded to Main Street organizations to support businesses in those communities. Lastly, the Office of Rural Broadband and DHCD is administering nearly $24 million in broadband funding for educational needs. $8.7 million was awarded to local school districts in August to provide for students' short-term needs, either by providing internet access through existing providers in urban areas or by providing wireless access devices to students where infrastructure is not in place. The remaining $15 million is for the construction of a new educational broadband network. DHCD has awarded the funds to the nonprofit Collaborative Solutions Maryland, or CSM, which will construct the network and operate it in collaboration with local school districts. CSM is in the process of contracting out for a feasibility and design study, which will clarify the project costs and timeline. However, DHCD projects that construction will begin this spring, with the first counties online this summer and the full network operational by the end of 2021. Local school districts will need to cover the operational costs of the network once it's been constructed. But since these costs are not yet known, school districts have not yet decided whether or not to participate. DHCD advises that in the event that the cost of the network is less than the $15 million provided, the remaining funds will be used either for startup costs for the school districts or to expand the network to support unserved students in urban areas. Because many of the project details are still unknown, DLS recommends requesting 2 reports from DHCD in collaboration with MSDE. One in June to provide details on the project schedule, as well as construction and operating costs, and another in December to update the committees on the network's progress. Now I'm going to turn to the new rental assistance funding from the December stimulus. DHCD received its allocation of $258.1 million from the US Treasury on January 26th, but is still waiting for additional federal guidance before making plans to distribute the funds. The governor also announced his intention that DHCD work with the General Assembly on a distribution plan. The funding can be used to provide up to 12 months of rental or utility assistance to households with income at or below 80% of area median income, with priority for households below 50% or with residents who have been unemployed for 90 days. Funds must be obligated by the end of September and expended by the end of December. Statewide, the total funding is $401.6 million. And estimates of the direct allocation for the largest local jurisdictions are shown in Exhibit 6. DHCD expects that the department's allocation will be eligible for use across all jurisdictions, not just those that didn't receive a direct allocation, but they're still waiting on guidance. As you're all aware, the COVID-19 pandemic has exacerbated housing insecurity. Exhibit 7 on page 17 shows the percentage of Maryland renters who are behind on rent in November, based on data from the US Census Bureau. Black and low-income renters have been particularly hard hit, with 35% of Black renters in the state behind on rent compared to 14% of white renters, and 30% of renters with income below $50,000 behind compared to 14% for those with higher incomes. Based on this data, the Stout Consulting Company estimated that the rent shortfall in Maryland would total between $206 million and $381 million in January 2021. This lines up with recent data from the Maryland Multi-Housing Association, which estimated that a total of $378 million in rental assistance was needed to cover the delinquent rent in Maryland as of January. Their survey also indicated that approximately 20% of Maryland renters were behind on rent in January, with average delinquent rent of a little over $2,500 among the properties surveyed. By these estimates, the $402 million provided by the new federal stimulus is enough to cover the current rental shortfall. However, the shortfall will continue to grow as renters miss more payments. Moody's estimates that delinquent rent, utilities, and late fees will still total nearly $35 billion nationally by April, with the assumption that all of the new federal relief from December legislation is distributed in February and March. Lastly, I want to talk about eviction filings. Despite restricted court operations and eviction moratoriums at both the state and federal levels, both eviction filings and evictions have continued to take place during the pandemic. Exhibit 8 on page 18 shows failure to pay rent cases filed in blue and evictions in red from November 2019 to November 2020. The general shape follows closely with court operations. Courts resumed hearing various types of landlord-tenant cases in July and August, but restricted operations again in November, so that only emergency eviction cases can be heard, but failure to pay rent cases can still be filed. Overall, failure to pay rent cases filed between July and November 2020 declined 60% compared to the same period in 2019, and evictions decreased 73%. However, it's worth noting that tenant holding over cases, where a tenant remains on the property after the lease ends, actually increased 67% over this period, although these are still a very small fraction of the total landlord-tenant cases compared to the failure to pay rent filings. Finally, page 19 shows the DLS recommendation, which is the suggested narrative requesting reports on construction of the educational broadband network. That concludes my presentation. I'd be happy to take any questions.
Well, thank you very much. Are there any questions for the analyst? Delegate Henson.
Thank you, Mr. Chairman. Thank you for the detailed report. I know that the report focused a lot on the relief efforts that are being managed by DHCD, but I did have I was looking at the audit that was done by OLA that was issued back in July, and I have some questions about some of the internal operations. Specifically, I was wondering if we had any information on the number of employees there that were contractual and the number that were FTEs. And then if we had any information on that based on which unit or component they work for the department.
Sure. I don't have, I can get you the breakdown by department. I don't have that off the top of my head, so I can get back to you. In terms of a number of PINs and contractual employees, the fiscal 2022 allowance is unchanged for regular positions at 331 overall for the department, while contractual positions decreased slightly from 94 in fiscal 2021 to 89 in the fiscal 2022 allowance. And the department may be able to provide more detail on their staffing and those changes.
Thank you.
Thank you. Any additional questions? All right, seeing none, we're going to move on to the department's presentation. Give me 1 second. We're going to bring up Mr. Owen McAvoy and Ms. Robin Jaconis. Before you begin, I do want to ask a question. On the witness list, I have multiple people signed up from DHCD, and I want to make sure that we're all calling them if they are here to speak or simply to answer questions. So just to give you a heads up, I have Kendra Gordon, Stuart Campbell, Elizabeth Trujillo, Hunter Pickles, Matthew Heckles, Carol Gilbert, Sergey Kuzmenichuk, Kendra Gordon again. That's clearly an error. So are they all here just to answer questions, or are we all speaking?
This is Deputy Secretary McAvoy. They're here to answer questions. We didn't anticipate them speaking. I think both myself and our Chief of Staff, Robin Jaconis, will do the initial presentation, and then we're going to open it up to questions.
Perfect. Sounds good. Well, please go ahead and kick it off.
Great. Well, I'd like to introduce myself. I'm Owen McAvoy, the Deputy Secretary of the Department. I send the regrets from the Secretary that he could not be here today. Joining me is Robin Jaconis, our Chief of Staff. I want to thank Emily for her very thorough analysis. She was a joy to work with. We worked very well together. I'd like to draw everybody's attention to, we provided everyone maps by county and jurisdiction outlining the awards for a lot of our programs. We're happy to answer questions on that. And as for DLS's recommendations and analysis, we concur with the report requirement. We have Kendra Gordon here who can answer any questions about our broadband program. And we have the rest of our leadership team on standby. And we're just here to listen and answer questions regarding our budget and other issues.
Mr. Jaconis?
Robin?
Oh, I'm sorry. Are you waiting on me? I apologize. So just hello, everybody. Thank you for the analysis. Emily, you did a great job. Yeah, we're really happy to answer any questions that you may have about our budget. As the Deputy Secretary mentioned, we provide maps in the back of our response document. We find that a lot of people enjoy those maps because they go program by program, and they show the awards that we've provided through fiscal year 20. We also have some maps included this year for the COVID relief funding that we provided. So you just may want to take a minute to take a look at those maps, but really we're happy to answer any questions you may have.
Wonderful, thank you. We have a number of questions. So we'll start with Senator Eckert.
Thank you very much. And I look forward, first of all, thank you, Housing and Community Development, because you've been most responsive to our community. And our community members were on a call last night and they couldn't say enough about how responsive you all have been to folks in Cambridge. And I know that goes for our other jurisdictions on the shore as well. But to Mr. Gordon, thank you for your effort. Broadband is essential for us in the rural areas. We have places where there is no connection. So just that educational connection is very important. So I wanted to say kudos to you all, and I look forward to your report and update on the rollout with the educational broadband initiatives. Thank you, Mr. Chairman, Madam Chair.
Thank you. Let's move to House Vice Chair Valentino Smith.
Thank you, Mr. Chairman, and thank you, Deputy Secretary. I also wanted to give a shout out to Stuart Campbell, who always spent a tremendous amount of time working with the Joint Committee on Ending Homelessness and his staff for the work he does with that. Just 2 or 3 quick questions. One, on page 5, where the analyst keeps talking to us about the fact that there's a $258 million working appropriation that isn't accounted for yet, waiting for a budget amendment. Do you have any sense of when that's coming in or how that's going to be applied?
I'm going to ask Robin to answer that. She probably has the background.
Sure. So we're convening the work group right now. We've actually just scheduled the first meeting for the 6 legislative members, along with Secretary Holt and Secretary Brinkley. We'll be meeting for the first time on February 22nd. Once that work group has an opportunity to discuss the implementation of the money, we will start working on the budget amendments soon thereafter.
Okay, so I didn't realize that's all subject to the work group. On page 15, where it talks about the local jurisdiction allocation for rental assistance, was there a formula for that, or was it based on need or application, or how was the decision made to allocate the rental assistance by jurisdiction?
There were several series of funding there. I'm going to ask, I believe Carol Gilbert, our Assistant Secretary, who oversaw that program, is on the phone. Can she chime in to kind of go over the formula we used? Carol?
Unmute myself. Yes, thank you, Deputy Secretary McAvoy and members of the Joint Committee. The allocations on page 15 for the Federal Emergency Rental Assistance Program were determined by a population-based formula administered by HUD. Sorry for my dog in the background, poor timing. And so those 8 jurisdictions are the most populous 8 jurisdictions in Maryland, and the remainder of the funding is with DHCD to distribute statewide.
Okay, so it was based on population. Thank you.
Thank you. And right after I call on Delegate Henson next and then Delegate Young afterwards, I am now going to drop off and I will hand the reins over to Chair Griffith to conclude. I should be back in half an hour if we are still meeting.
Right.
Thank you, Mr. Chair. Thank you, Madam Chair. If I could just pick up where Delegate Valentina Smith's question left off with the allocations of the rental assistance, it looks like the remaining portion that DHCD has to distribute, you have some discretion there. It's not based on the populations that the original funding was given to directly. It looks like there's a great disparity in who's being impacted by the eviction crisis that we're experiencing in Maryland. With the remaining portion that you have in funds, what's your algorithm for distributing that? And are you considering the disparate impact of evictions?
Yes, thank you for the question. We are looking at various scenarios based on population and social equity issues. And we have not determined yet a specific logarithm, but we will be guided by the disparate impact issues you've identified.
Thank you. Madam Chair, may I be permitted an additional question? Thank you. Looking at the Office of Legislative Audits reports, finding number 4 indicated that DHCD did not monitor multifamily housing loans timely and effectively for compliance. There was some budget language last session that produced a report on the contract management, function that you do out of CDA, and then the compliance monitoring that you do out of CDA as well. And I'll just note anecdotally that I have constituents that live in properties that are subject to the oversight of DHCD, and the phone numbers that they're supposed to be able to call to lodge their complaints when they have housing quality issues, when they have issues with their rental files being managed properly, those phone numbers have been largely ineffective for people to reach someone that has the oversight authority to be able to manage those concerns. As it relates to monitoring for compliance, what progress has the agency made and what additional steps are you looking to take?
Delegate, I'm going to turn it over to our Assistant Secretary, Matt Heckles, just to say that we are familiar with some of those issues. As a former county official in Anne Arundel County, I'm aware of probably a lot of the same properties you're talking about. But I'll turn it over to Matt to kind of talk about their process and how they're working to improve things. Matt?
Sure. Well, Delegate, we've had, I think, several conversations about this, and I appreciate the question and the encouragement that we continue to improve. How we ensure that the housing that is financed by CDA remains, very high quality, which we believe in general it absolutely does. And depending on the different types of programs, we have different enforcement roles to play. If we are simply allocating the tax credit, I think that our role is somewhat removed. But if we have state funding in the project, then of course we're much more involved. With the contract administration, we are essentially acting on HUD's behalf, so we do have a monitoring role there. But most of the physical inspections are actually performed by HUD. So it really depends, which funding source and which program, down to the property level. It really depends on that, how much ability we have to, or what role we play in terms of monitoring and asset management, and then how much authority we have to effectuate change if change is needed. We're always a good resource, I think, for residents to contact us and to then act as a liaison between the residents and the management companies and owners of affordable housing at any level around the state. And so we continue to play that role at the very least, and then we go from there. We're very much looking at all of the different pieces of legislation concerning this, and are committed to making sure that affordable housing remains affordable. That is our primary responsibility. But beyond that, that it is of high quality, that it is a positive for the neighborhood in which it's situated, that it's energy efficient, that it's just a great place to live. So that is our ultimate goal, and our asset management role does allow us, I think, to make sure that happens over the life of a project, which can be, as you know, 30 or 40 years sometimes. And that older properties obviously pose challenges, but we stay involved for that very reason.
Thank you for the response, and thank you for your availability to troubleshoot issues as they come up. Yourself and Mr. Pickles have been incredibly gracious on that. I did just want to underscore that doing that effectively is incredibly hard if the resident voices are not able to be incorporated into the reports and incorporated into the oversight process. If the communication is between the department and management, you really lose a valuable component, and that's the person that's there 24/7, the person that lives there. So I would encourage finding new solutions to make sure that the resident voice and all of our constituents gets to be an impactful part of the process. Thank you.
Thank you, Delegate. We'll turn now to Delegate Young.
Thank you, Madam Chair. Mr. McAvoy, wanted to just, you mentioned that you have someone here to talk about rural broadband, and just wanted to get an opportunity for you. I know DLS had talked about it. I know some of the partnerships, there's a report coming out, but while you're here, if somebody could kind of just give us a quick run through where you guys at, what we can expect to see, and especially now with what's been going on, how are you all doing with that expansion?
Sure, and I'll turn it over to Rick Gordon in a second. I guess big picture, obviously our Office of Rural Broadband was very involved in connecting a lot of students to internet access because of the pandemic. This crisis has really demonstrated the need for that. We were moving very swiftly and quickly to ensure that, and Rick can kind of outline in detail our efforts over the past year or so to make sure that everybody has a connection to the internet. Rick?
Thank you, Deputy Secretary McAvoy. Delegate Young, thank you for the question. So we attack the lack of broadband in several different manners. We have our permanent programs, which last year we provided approximately $11 million, without doing the math, on to those permanent programs across 9 different jurisdictions, if I'm not mistaken. And then we also provided funds for emergency connectivity. So when COVID first hit, the end of March, we offered emergency grants to schools and libraries. Most of those went to libraries that did a lot of hotspots. Some of the libraries did external wireless access points. Many of the schools did external wireless access points. What that allowed was a student to come to the closed school building and remain in their safe car and connect to the internet. We admittedly don't think that's a great solution, but at the time it was the fastest thing that we could do. And we provided grants to probably another 11 jurisdictions for that program. This fall, the governor provided $5 million in relief funds for unserved rural students and another $5 million for unserved urban students. And we provided grants to 22 of the 24 school districts for $8.7 million for unserved student connectivity. And that, again, a lot went to hotspots because that was the quick, easy solution. We also allowed funding to go to wireline providers to pay for service to households that could attach to those wireline providers. We tried to be as flexible as we could and help the school districts as much as possible. This year, we just accepted grant applications for our standard running programs, the Broadband Extension Program and the Broadband Network Infrastructure Program. We received over 74 applications and for $30 million worth of funding. So we're extremely oversubscribed in the coming year. So apparently last year was our first year of offering some of these programs, and we did well last year. This year we are oversubscribed by probably $20 million. So we're going to continue with those programs.
Sure. And I know that the work you do can't be done without your partners, and we've been having extensive conversations about the Maryland Broadband Collective, and just wanted to make sure that that relationship stays strong and that it expands with your other partners.
Yep. And we appreciate that.
All right. Thank you, Madam Chair.
Thank you. I don't see any further questions for this panel. So thank you, Mr. Deputy Secretary and your team. We do have 2 witnesses signed up to testify on this budget. I have an Amy Bairn and an Ingrid Lofgren. You're on deck. So thank you. I hope I pronounced your names correctly, but Amy, you can proceed.
Great, thank you. I appreciate that. Dear Chair Griffith and members of the subcommittee, my name is Amy Byrne. You were very close. And I am testifying on behalf of MHP in support of the governor's budget for the Department of Housing and Community Development. By way of background, MHP is, oh yeah, I'm on. Okay, sorry. MHP is a nonprofit affordable housing provider with apartment communities located in Montgomery and Prince George's counties. We are pleased to see that the governor's budget included full funding for the programs that support the preservation and construction of affordable housing. And I want to highlight one program that is of particular importance to affordable housing providers and small businesses, and which receives a portion of its funding through the general fund. The National Capital Strategic Economic Development Fund, or NED for short, aims to improve the economic potential of blighted areas in Montgomery and Prince George's counties, particularly inside the Beltway. NED supports a wide range of uses as it relates to housing, including site acquisition, engineering and design, and rehab of single-family homes. Affordable housing is rife with risks, especially in urban areas where the costs are much higher, and the NED program helps mitigate against a lot of these risks. Additionally, NED supports the commercial redevelopment of business districts in need of revitalization. So projects are typically focused within older commercial districts that contain high concentrations of small, minority, and women-owned businesses, which have been especially hard hit by the pandemic. NED funds have been used to support facade improvements for small businesses, as well as public infrastructure projects that improve the curb appeal of businesses. In closing, NED is critical to ensuring that we maintain a diverse mix of affordable housing options in Montgomery and Prince George's counties, and to positioning small businesses to recover from the pandemic stronger than ever. So we urge you in the strongest possible terms to approve of the governor's budget as proposed. And we thank you for considering our views on the matter.
Thank you. Ms. Lofgren.
Good afternoon, Chair Griffith, Vice Chair Valentino-Smith, and members of the subcommittees. My name is Ingrid Lofgren. I'm Director of Youth Initiatives at Homeless Persons Representation Project, which is a legal services nonprofit that provides free representation to prevent and end homelessness in Maryland. We would like to highlight DHCD's efforts to prevent and end youth homelessness, which represents a minuscule portion of the budget, but has a really critical impact for our communities. DHCD has had $1 million annually for the past 3 fiscal years since the legislature unanimously passed the Ending Youth Homelessness Act of 2018 that it targets for housing and supportive services for unaccompanied youth experiencing or at risk of homelessness in counties across the state. I've been told that there is $1 million again in the fiscal 22 budget for this purpose. And I hope that in the future, DHCD might be able to increase this funding, but protecting the money that is in the budget for this year is critically important, particularly given the impact of the coronavirus pandemic on youth and on the organizations that serve them. So the money currently is funding programs in Anne Arundel County, Baltimore City, Baltimore County, Howard, Hartford, Carroll, Washington, and the 5 counties on the Midshore. So it really is reaching youth across the state, and it's filling gaps left by restrictive limitations in federal funding for homeless services. It's helping to build capacity of programs in communities that have had no targeted housing and services for homeless youth so that they're better able to draw down available federal funds. And the funding also supports the state Youth Reach initiative, which is an enumeration and survey of youth experiencing homelessness that the Institute for Innovation and Implementation at the University of Maryland, Baltimore has contracted with the DHCD to lead since 2015. and that has expanded significantly and has been critical in illustrating that youth homelessness exists throughout Maryland at levels that far exceed what we previously had estimated. So thank DHCD for their partnership in this area, particularly Carol Gilbert and Stuart Campbell, who are in this meeting, and look forward to continuing to partner with their work, and thank the legislature for your support over the years on this issue and of this funding.
Thank you, and thank you both for your testimony. Are there any questions for these witnesses? Okay, seeing none, then we'll thank our analyst, Ms. Haskell, thank the agency and the witnesses. That will conclude the hearing on the Department of Housing and Community Development budget. Members will now turn to the Department of Disabilities. We have Grace Pedersen, who is our analyst. So you have the floor. Good afternoon.
Good afternoon. Thank you, Madam Chair. Is that coming up okay? Okay. So it's my pleasure to present the Department of Disabilities Fiscal 2022 budget analysis. So the Department of Disabilities offers a variety of services to individuals with disabilities, and also offers accessibility expertise to other state agencies. I'll jump to this first graph. The department's budget increases about $900,000 or 8% to a total of more than $12 million in fiscal 2022. This increase is mostly driven by an increase in one contract in the Telecommunications Access of Maryland program, or TAM, as it's abbreviated. TAM makes up the largest share of the agency's budget, and this is a new addition. TAM was newly transferred to the department in fiscal 2021. TAM used to be located in the Department of Information Technology. So here is an overview of those changes in the department's budget. I'd like to direct your attention here to the changes in accessible or assistive technology. So that increase driving most of the budget's changes for the Maryland Relay Services contract, which increases $1 million from fiscal 2021. And that's because a new contract term is being exercised and the expected contract costs are planned to increase. Maryland Relay Services offers accessible telephone options to Marylanders. Other changes make up some of the budget's increase, but that's partially offset by a $186,000 decrease for the Maryland Promoting Readiness of Minors and Supplemental Security Income, which was a pilot program from the federal government that Maryland was selected to participate in to study the effects of additional educational and employment services. So that pilot program ended with federal fiscal 2020. So there was only one quarter of funding in federal in the state fiscal 2021 because of the overlap in the fiscal years. And the removal of funding for that pilot program results in the small decrease in contractual positions in the agency, less than a whole position. Then I just have one key observation for you. It has to do with the statewide Information Technology Accessibility Initiative. So this is a project that the Department of Disabilities is working with the Department of Information Technology and the Department of General Services to evaluate and improve the non-visual accessibility of the state's online presence. In fiscal 2021 and 2022, in 2020 and 2021, 2 staff were devoted to the position and an unpaid intern. And these staff review state agency websites, and they were asked to review pandemic-related websites as well. The staff also created online IT accessibility concern forms where the public or state agency staff could report concerns about non-visual accessibility, and a specific form related to pandemic-related concerns was also developed. So as this initiative takes shape and the Department of Disabilities works with the Department of General Services and the Department of Information Technology to solidify how the initiative will move forward, the Department of Legislative Services recommends adopting committee narrative to better understand the long-term vision for the initiative. And and what degree of accessibility it hopes to achieve through this initiative. And that concludes my presentation. I'd be happy to take any questions.
Sorry, couldn't find my unmute button. Any questions for Ms. Pedersen, our analyst? Well, very good. Seeing none, we will move to Honorable Carol Beatty, who is the Secretary for the Maryland Department of Disabilities. Again, we see a number of people from the department signed up on the list, so you can introduce your panel and anyone that will be joining you in your presentation.
Well, good afternoon, and thank you, Chair Griffin and Vice Chair Valentino Smith and members of the subcommittee. I am Carol Beatty. I'm the Secretary of the Department of Disabilities, and with me is Deputy Assistant Secretary John Brennan. We also, as the Chair noticed, we have many of our directors on this meeting, Zoom meeting, in case there are questions that we would like to hand off to them to answer. We would like to thank our analyst, Miss Grace Peterson. She's did a wonderful job, very thorough job, and we thank you for that. And thank you for working so diligently with John to kind of explore those issues and to get answers for them. You have our written testimony, and so what I'd like to do is, with your permission, to discuss more thoroughly the two issues raised in the analysis, and then turn it over for questions, if that's okay. So the analyst asked us to comment on MDOD's plans to fill the 4 vacancies. As you know, I'm sure you're all as aware as we are, due to COVID-19 state of emergency, the state of Maryland implemented a hiring freeze in April of 2020. The hiring freeze exemptions are granted on a case-by-case basis. Prior to the pandemic, we were in the final stages of the recruitment process for 2 of the 4 positions. So here is our update on the 4 positions. The administrative 2 position was attached to the expired federally funded Promise program. So we are in the process right now of evaluating our options for reassigning that PIN. There are 2 ideas that we're really exploring. These include adding it to the Maryland Technology Assistance Program, which we refer to as TAP, to expand our assisted technology demonstration and loan activities. Or the other thing that we're looking at is to move it to the Telecommunication Access Maryland program, which is TAM, to support the creation of a deaf-blind interpreter program. So we plan to fill the position by the first quarter of fiscal year 2022. The assisted technology clinician position vacancy is at Maryland TAP. After several unsuccessful recruitments, we submitted the PIN for classification study in November of 2020. We have a contract employee who is currently carrying out these functions, and we expect to fill this by the end of FY21 after the study is done and we receive a hiring freeze exemption. The fiscal administrator for TAM is a vacancy. We've received a hiring freeze exemption for this vacancy, and we've posted the position on the state's job posting website, and we expect to hire by April. And then the last one is the Maryland Accessible Telecommunications Specialist for TAM. We have a contract employee who's currently carrying out those duties since October of 2020, and we received a hiring freeze exemption for this position in November of 2020. This position will be filled in April through a contractual conversion. Our Deputy Assistant Secretary John Brennan will address the second issue regarding the statewide information technology accessibility initiative. Mr. Brennan oversees the department's accessibility and technology efforts. So I'm going to move our laptop over to him.
Thank you, Secretary Beatty. Good afternoon, Madam Chair Griffith, Vice Chair Valentino Smith, and to all the members of the joint committees present today. For the record, as Secretary Beatty mentioned, my name is John Brennan, and I serve as the Deputy Assistant Secretary for the Maryland Department of Disabilities. I'd also like to echo Secretary Beatty's praise for the quality and thoroughness of Ms. Peterson's analysis, and to thank you for the opportunity to address the committees on the topic of the statewide information technology initiative. This is a topic with that's fairly detailed with a lot of moving parts. And so I'm going to err on the side of being brief and try to enable opportunity for as many questions if anyone feels like I haven't addressed everything either through our written testimony or my oral comments. So with that, I would like to say that we support the recommended action with amendments. As you can see in our written testimony, we've offered amendments, and we'd like to note also that our written response to the recommended action that is listed on page 8 is also addressed in our response to the recommended action. My intention today is to address the status of the NBA initiative and to explain the reasons behind the suggested amendments we are respectfully asking the subcommittee to consider, while also doing my best to refrain from repeating what we've already provided in our written testimony. The analyst correctly points out on pages 7 and 8 of the analysis that MDOD has not yet provided a detailed long-term strategic plan on the initiative or an overall assessment of the current non-visual accessibility of state websites in the level of detail that was requested in the 2020 JCR. Also, while we started work on developing a procurement guideline document, we're not as far as along as we had planned at this time. I'd like to also acknowledge that these are important pieces of information to provide, and we're working on bringing them to completion as soon as possible. With that being said, there have been some significant circumstances and challenges that have hampered our ability to make as much progress on these tasks as we had hoped. And I'll try to outline those now. First is staffing. As it was mentioned, we had 2 staff people devoted to the IT initiative within our department starting in FY20. The first one was hired at the end in late November, just as we were starting to develop this initiative. And the second was brought on in April of 2020, just as the pandemic hit. So just as we had a complement of full staff and we're ready to ramp up our efforts in this area, we were impacted significantly by COVID-19. And that sort of brings us to our second challenge, which you've probably all heard repeatedly from many agencies, is the staffing is the challenge that COVID-19 has presented with us specific to this initiative. Since March of 2020, 1 month before we hired our second staff person, we've had to focus and really shift the major amount, our focus on prioritizing the evaluation of COVID-19 specific information, whether it be through website content, informational documents, or other applications for accessibility. These have included most of the emergency-related executive orders that have been issued by the governor's office, the coronavirus and COVID Connect websites, and the Maryland COVID Alert tracking app, just to name a few. Second, also an impact of COVID is that our ability to collaborate with the other agencies that are required for us to be able to take action on this initiative, primarily the Department of Information Technology, as well as the Department of General Services Office of State Procurement, was severely impacted by COVID because they had to do the same thing. Their staff has had to shift their priorities primarily to responding to the challenges of the pandemic. And in particular, at DoIT, an additional challenge was that they've had a fair amount of staff turnover over the last fiscal year. And so we haven't been able to maintain the momentum of progress that we anticipated achieving until they had a full complement of staff in place. And again, our points of contact have shifted quite regularly. And that is our key partner in this initiative and implementing the various action steps that we've outlined. Another challenge has been the fact that the Department of General Services Office of State Procurement in late 2019, all the procurement responsibilities shifted over to that department, including responsibility for IT procurements. So that presented a fairly large learning curve for our two staff in terms of figuring out how their processes were impacted by that shift, who the key personnel were in the DGS Office of State Procurement that we needed to interact with in order to ensure that we could develop some processes that they would work into their procurement process to ensure that state agencies were procuring accessible IT information and software products. So while these challenges have been significant, given our resources and the scope of this initiative, progress has been made and work has started on all of the items previously mentioned. Many of those activities have already been provided in our response to the 2020 JCR, as well as in the analysis. In the interest of time, I won't list them all now, but we will include them in our response that is required on July 1st, 2021. Finally, I'd like to draw the committee's attention to the suggested amendments to the recommended narrative that we've included in our written testimony. While I won't repeat the information that we've already provided, I would like to highlight the two primary reasons we're suggesting these amendments. The first is to more accurately reflect our role in assisting the Department of Information Technology as the lead agency for ensuring non-visual access compliance, and the Department of General Services Office of State Procurement as the lead agency for implementing processes, like I said, that ensure the procurement of accessible IT products. While I won't review the exact language, our role in this initiative is really to provide them with technical assistance and help them to increase the overall level of accessibility as it relates to non-visual access in the state. And so those amendments that we have suggested, we think, like I said, are more accurately define that role and will help us accomplish what it is that the DLS is recommending that we provide. Also, it will help, the suggested language is meant to more accurately align the core activities that MDOD is directly responsible for under this initiative, which are primarily evaluation, training, outreach, and technical assistance. Just for example's sake, while it's nearly impossible to accurately assess the proportion of state websites that will be accessible by June 30, 2022, we do feel it's realistic for us to be able to assess the proportion of state websites that we anticipate to have improved accessibility based on the joint efforts of DoIT and MDOD staff. Also, while we don't have the staffing and resources to evaluate and remediate all state documents, which number in the hundreds of thousands, for accessibility, we do offer an alternative language outlining a targeted document assessment strategy that is in line with our specific role and available resources. So I'd like to close by once again thanking the committees for the opportunity to provide our testimony, and to thank you in advance for considering our amendments to the recommended narrative. We'd be happy to answer any questions that any of the members might have, and we also have staff present in case we need to refer to them. Thank you.
Thank you very much. Are there any questions for the department? Vice Chair Valentino Smith.
Thank you, and thank you, Deputy Secretary Brenner. And well, you know, we appreciate the significant challenges that you've explained to us with respect to your ability to complete the JCR with more detail and give us the information that we need, and redirecting us to the need for more directed JCR language for DoIT. Would you please at least provide the assessments that you did do of the state agencies, because it said that you were able to do 23 state agency review requests and 9 web pages. And if we could at least see the detail of the work that you have completed in your analysis, because at least from the House's perspective, the Senate's with us now for the first time, but I imagine it might be the same. We've been very concerned, probably for the last 2 years, about the accessibility for not only the hearing impaired and sight impaired both, to state agencies and to the General Assembly website and the ability to get information. And I feel like we're going to stumble now for another year. So if we could at least see what you've got so far and confirm you're doing this analysis both for hearing and sight impaired access?
We run two types of evaluations of a website. One is manual, which involves whoever the reviewer is, one of our two staff actually going in and doing some manual testing of it, and the other is automatic. And we test it against certain accessibility standards, which includes non-visual access, as well as for people who are deaf or hearing impaired. So yes, and we can provide that data. We'll definitely provide it by the deadline requested in the analysis, or if you want it sooner, we can do it.
Just what you have, if you could provide it. I think it would be helpful if there's a website that's working for a particular agency or not, or what we can see at this time would be helpful. Madam Chair, if I may, just one more brief question.
Sure.
So help me understand how you have a form on the website for people to fill out about their concerns, but if you can't see the website or access the website, how is the community able to really communicate with you regarding their concerns? Have there been more outreach to the disabled community to elicit what their concerns are, or is it just expected to be reactionary based on whether they see the form on the website, which if they can't see, how do they know it's there?
The concern form is listed on MDOD's on the TAP website. I have Andrew Drummond here, who is the IT accessibility coordinator, and I'd like to turn this question over to him to give you more details on that particular issue.
Good afternoon, House Vice Chair Valentino. Hope this will be well. And good afternoon to the rest of the legislature. It's a very good question. The website, the MDOD website, is accessible to people with disabilities. So if you're an individual that relies on non-visual access, for example, if you're blind or you have low vision, you have a visual challenge, you can use.
Just 1 second. I'm having a little difficulty as I'm getting a little muffled sound. I don't know if you can adjust your microphone. Okay, you want to try again?
Sorry, just a second.
Okay.
Is that better now?
It is.
Wonderful. I was trying to state that the Maryland Department of Disabilities website is accessible to people with and without disabilities. So if you have a physical impairment, you have a visual impairment, you're blind, you're low vision, you're deaf or hard of hearing, you'll still get to access our website. You get to use some software, a software called a screen reader if you're blind or visually impaired. And that screen reading software will allow you to access our website, and it'll also allow you to access a form that we've created so that the constituents can share a concern, or even a state employee could share a concern about a website. And we've actually received a concern or a question using this form from people that rely on non-visual access, so people that are blind. So the form works.
Thank you, Madam Chair. I just remain concerned that it says they only received 4 forms in 2020 and 10 forms in 2021. So I guess I would just in closing encourage the department to try to elicit more proactive evaluation of the websites rather than reactive through filling out the form. Maybe work with your community in some communications that you send out to elicit proactively their review and concerns would be helpful. Thank you, Madam Chair.
Thank you. Any additional questions for the department from members? Okay, seeing none, we do have 4 witnesses signed up for this budget. I have Rachel London, Amanda Lay, David Bahar, and Anna Lewis. So we'll go in that order, and you can proceed, Ms. London. Good afternoon.
Good afternoon, Madam Chair. I'm Rachel London, the Executive Director of the Maryland Developmental Disabilities Council. We're part of the Department of Disabilities Funding, so I actually was only here to answer any questions should they come up.
Okay.
Thank you.
Okay, and was that the case for Amanda Lay also? Do you know?
I don't believe she is on. She is a council member of mine. I don't see her on.
Okay, then thank you very much for being here. We'll go to, Vice Chair, I see your hand raised. Was that a, no, okay. We'll move to David Bahar. Good afternoon.
Hello, good afternoon, Madam Chair. I'm also only here to answer questions, same as Rachel. Thank you so much.
Okay, and then last, maybe testimony from Anna Lewis with National Federation for the Blind.
Thank you for that correction. It means a lot to me that you
I
recognize
know,
that.
I spoke at a conference and they told me to get it right, so I'm.
It's all out of love. So, Madam Chair, thank you, members of the Joint Committee. My name is Anil Lewis. I'm the Executive Director of Blindness Initiatives for the National Federation of the Blind. I really want to speak in support of the work that Maryland Department of Disabilities is doing. So before I get into my testimony, which unfortunately I wasn't able to, I don't think it came through because of some problems with the accessibility of the website to register to testify, but I'm following up on that. I wanted to address a couple of things that you mentioned. One, I want to really express support in the model that was described by Assistant Deputy John Brennan. The exemplary practice that we in the National Federation of the Blind, as a global expert in non-visual accessibility, talk about is having dedicated expertise, but also promoting enculturation. So having the responsibility to address this issue housed within the Maryland Department of Disability is best practice. Working with Do It and GSA are really, again, best practice, working to enculturate the knowledge and the importance of accessibility into the entities that are providing the fundamental infrastructure for that. That's where you're gonna have the big win-win. And I'd also address that it takes a while to kind of build that economies of scale. So don't be too disappointed in the numbers, believing they will grow exponentially now that that's being implemented. And then of the last question, I agree, we do have to do a better job of doing outreach, but even more so as a membership organization of blind people, we recognize that individuals are more prone to be frustrated about inaccessibility and not take any action. So we're working very diligently to make sure we empower and encourage our members to be more proactive as well. So I appreciate that feedback. We are extremely happy with the public-private partnership we've enjoyed with the state of Maryland through our relationship with the Maryland Department of Disability, with support from the Non-Visual Accessibility Initiatives grant. And over the years, what we found is we've been able to really build on that partnership and leverage our relationships with corporate partners to really create a more accessible Maryland. And we've identified really 6 focus areas that we've really focused on. One, education. This became even more important last year because during the pandemic, when everybody's going to virtual everything, education was premier, and you probably are aware of how difficult the education, virtual education of just regular students was. You can only imagine how exponentially the difficulty of providing a quality education to blind students was exponential. So we were able to, through our partnership, really be proactive in addressing those issues, developing relationships with our partners, expressing the importance of accessibility with respect to all the educational software. Our relationship with the big companies, especially with Google, also paid off with us being able to provide training. So education is one of those pillars. The other is employment, and we've recently started pushing into that, and we're going to be moving into that in a more dramatic fashion and making sure that blind and low vision individuals, citizens of Maryland, are able to take advantage of the tools and the resources available to obtain employment. The other is we've done a lot around smart cities, as we just finished our Smart Cities Summit. Members of the staff of MDOD also co-presented, again, highlighting the work that we're doing together to create more accessible spaces within the state of Maryland, being an exemplar for the nation. So that we're working on those particular initiatives. We continue to do our technology trainings. And I was checking my notes from my testimony from last year, and I forget, there was a delegate that asked that we provide some information around how to create accessible documents. And it's just interesting that on February 17th, we'll actually be promoting through the NBAI a whole half-day conference on creating accessible documents. I'll make sure I push that out to whoever I can to make sure that those individuals who work within your offices who are creating, whether it be those PDF documents or those EPUB documents, or maybe editing your web spaces, can participate so that they can learn those fundamental skills to make sure that as they're developing that content is, as the term says now, born accessible. So our technology training still go forward. We are doing some interesting dynamic things around creating the building on the accessibility switchboard portal, which helps educate individuals in a non-technical way so that we can onboard them with respect to the tools and strategies and the importance of accessibility. And then I think one of the most important pieces that we're doing is also our Accessibility Fellows Program, where we're teaching the professors in the community colleges and universities to integrate accessibility within their curriculum, because the key is not trying to develop something and then make it accessible. The key is to make sure that accessibility is built in from the design process. And I've said many times over, and I quote from my friend at Facebook, accessible coding is just good coding. So as we develop that next generation of the individuals who are going to be developing that content, and they recognize that they can do it from the beginning in a way that produces something that's accessible, there will be no additional cost, it will be ease of use. And the thing that I always like to promote with all of the things that we're talking about, we're not just making these tools accessible to blind individuals. It's already shown that when you work to make websites, technology, services accessible to blind individuals, you make them more accessible for everyone, because multimodal access to information helps everybody. And that's why we love saying that we're part of this partnership to build a more accessible Maryland for every Maryland citizen. So we do want to support and appreciate the governor, including the NBAI grant in the budget, and hope to continue this dynamic partnership with MDOD and the state of Maryland.
Thank you so much for your testimony, and we look forward to receiving the information that you have offered for our offices. Are there any questions for Mr. Lewis? Okay, seeing no questions, then we will thank our analysts and we will thank our staff. We thank the members for your attention and your questions. Certainly thank the agencies. Madam Vice Chair, I don't know if you had any closing comments. I know you all need to run.
No, just always a pleasure. It's been a pleasure working with the Senate. Thank you.
Thank you. We'll see you all next time. Have a good afternoon. Be safe and stay protected.